Thanks, Professor Dr. Ankit and Madharia. Thanks for your wonderful lecture about the lumbar canal stenosis decompression through Foreman approach. If any colleagues in the conference have questions or give some discussions about that, Professor Joe Chunli, welcome. Professor Joe, would you like to discuss about the case, the PPT was shared by Dr. Madharia?
Okay. Thank you, Dr. Madharia and Dr. Gupta. Thank you for successful endoscopic surgery. So I have a question for Dr. Madharia. Can you hear me? Yeah.
Yes,
so
sir, I can hear you.
Yeah, I can learn your technique. Really, that's a step-by-step technique about the discectomy from an endoscopic technique. So my question is for you. I think you always like to use one kind of hook to firstly find the fragment, and then you will do the foraminoplasty use the high-speed bore. So why not change the steps? So in China, many spine surgery or endoscopic surgery like use the foraminoplasty first, then we can see the nerve and decompress the nerve. Then next we will use like a hook and other things to take the disc out. So can you explain your philosophy or your technique about your technique? Okay?
Yes. Also, I got your question. What you're asking is why not work on the burr first, work on the facets first, and then go into the disc and decompress that. Answer for that is because it is very safe. Go into the disc first because there are neural structures into the disc, and then come out and see the facets and visualize the facets and burr those. If we are trying to go to the first, that is usually we go it by X-ray guidance or CM guidance, and we may injure our nerve. Hello, can you hear me?
Yes, you can go.
So if we are first working on the facet joints, we can accidentally injure the nerves. But if we go into the disc first and then come out of it, we are very much safe as we can see all the structures, and it is very less chance of damaging any neural structures. So that's why we go first into the disc and then we come out to the facet joints.
So
I hope I have answered your question.
Yes, I know your thought, but I think if you use a hook, you cannot see the end of the hook. Sometimes, do you worry about you can injure the nerve or the dura?
We cannot injure the dura because the patient is awake. We feel every pain sensation. If we touch the nerves, he will tell us that he is experiencing pain, and then we can come out. Also, the tip of the hook is ballpoint. It is atraumatic. It cannot injure anything. So the beauty of this surgery lies in that the patient is awake. If the patient is asleep or he is under general anesthesia, it becomes a dangerous surgery. But if the patient is awake, he can feel everything what we are doing in the surgery, and if we are close to any neural structures, he can tell us. So it is very safe.
If I may allow to add to this point, what Dr. Ankit was mentioning was the inside-out technique, and whereas what Dr. was mentioning was about the outside-in. And when we go from inside-out, we can, the field is very clear. There's not much of bleeding. But when you start from outside-in, when you already erased facet joints, there can be significant bleeding, and that will disturb your area, and you end up taking more time to complete the surgery. So dealing with the disc first, which is an avascular area, and coming out and doing a foraminoplasty and dealing with facet definitely can give a better result, and your field is clear throughout. So I'm just adding to that. Thank you.
Thank you, Dr. Kumi. Thanks, Dr. Kumi. Professor Yeming would like to say something about the lectures by Dr. Madharia and Dr. Gupta. Yeming, hello. 严明老师，你用中文也可以，用英文也可以，用中文给大家讲一讲，或者英文
非常好
英文
非常棒，
印度专家。
没有任何的问题，能听懂我的意思？
刚才那个周教授他对他那个印度神钩特别感兴趣。其实那个盾头的那个前面是个小球的一个钩子，就是印度他们用的那个钩子。我觉得两个教授应该都在国内都见过是吧？这个钩子咱们国内有没有？杨老师跟周老师。
其实我主要是想问他为什么不先做这样成型，然后再去扫。然后他们的思路还是 inside outside 的，所以这是理念的问题，是吧，严明教授？
是的，我看也是。
杜博士，我在这儿说句话，你别翻译了。
啊，
这个东西最早不出现在印度。我们当时不去使用的原因很简单，因为我们能检查的范围更广。您能理解吗？
哎，
他们认为先做
需要那个我就说中文了啊。舌尖上的中国里面有一句话，简单的食材只需要高端的食材只需要最简单的烹饪技术。如果说你显露的和整个显露和减压的范围够好的话，你只需要最简单的工具就可以完成。我就说这么多，谢谢。这个工具我最早看到它的时候是2013年，我也算是参与研发者之一，因为那个时候我们的显露水平也不够。但是现在对我们来说，白给都不要。谢谢。
Thanks, Professor Madharia and Dr. Kupita. Thanks for your wonderful lectures. And Dr. Yeming, Professor Yeming and Professor Zhou, they give their opinions about the techniques you show us just now. You did inside, outside technique to decompression in the root. And generally in China, we do the decompression from the outside to the inside. Thanks so much.